breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos. My co-host, as always, Dr. Glenn Harrison. How's it going, buddy?
Doing good. So what are you doing on this fine evening?
Nothing, man. I'm just podcasting with you. How about yourself?
You're just going to knock it out.
Just hanging out with you. Yeah. That's like the highlight of my Tuesdays.
That doesn't sound very exciting. I guess my dog, I'm hanging out with my dog. So
there you go. So three amigos right here. Me, you, and Border.
Yes. So this is an interesting topic and you were kind of preparing for it. Low light laser therapy. So I'm going to let you kind of swing into this and we can, elaborate on it and hopefully people can see if it's helpful for them.
Yeah. So low light laser therapy, right? Really not really new because it's been around since like 1960 when it was discovered.
Okay.
But gaining some traction and like recognition and notoriety in the last couple of years, I would say more so than, in the past.
I know in Europe, it's been practiced a lot more than
Yep. And that's all dependent on like the FDA and stuff like that. But Before we get to the low light laser therapy, if this is your first time listening or watching the podcast, please hit like and subscribe and turn on notifications because we're going to continue to roll out new content like this each and every week. And hopefully we do something that's applicable to you. So let's talk about laser therapy. So what is low light laser therapy? Well, first off, it was basically discovered in like 1960. And what it basically is it involves exposing tissues to low light levels of red or near infrared light. And basically at that specific frequency, it does some things that we'll talk about in just a minute. So a lot of people, when you say, oh, like I'm using laser therapy, they go, well, isn't that like dangerous? Like I watched this in Austin Powers and Dr. Evil destroyed the moon with that,
Saber swords.
Yeah. I watched Star Wars and it looks like laser beams coming out of their lightsabers, but different types, right? So the difference of low light or low level laser therapy versus like other forms of laser therapy is actually like the light density that they use in low light laser therapy is really, really safe and doesn't cause actual like tissue damage, like cauterization or cutting that they can use in other forms of laser. So it's really safe, doesn't superheat the tissue like that. And that's the biggest difference between like low light laser therapy and like other forms of laser therapy. There is kind of a different form. It's not necessarily laser, but they use LEDs, which are light emitting diodes.
Yeah.
And what they are hypothesizing is that like it also causes photobiomodulation, which is like increases energy production and stuff like that. So there's more than one type of laser. They find that the wavelengths and the different frequencies of light penetrate at different depths. So that's where really figuring out, what the application of the laser is going to be is really imperative because
like the different protocols.
Yeah. Yep, exactly. Different frequencies, different wavelengths do different things, penetrate at different depths. So you want to make sure you're using it in the appropriate setting.
Yeah, and the interesting thing is, getting like what can it be? How can it help? What can it be used for? Is what you said about the study, and I had no clue about that study. Repeat that again.
Yeah, so one of the first studies they did with light or low light laser therapy was they actually took mice and they shaved them, right? And they had two groups, and one group had the laser application and the other group was normal. And they did it repetitively. And what they found was the group of mice that were under the lasers actually regenerated their hair more quickly than their counterparts that were not exposed.
Wow.
So that kind of brought up an interesting question of like, what is the mechanism? What is the mechanism? How does it work? And they don't quite understand exactly how it works to a T. And I think that a lot of people go, well, it's not even well understood. No, like they don't even know how it works. Well, do you know how hard it is to like examine a cell? They're really small anyways. And then you're, applying light to it. So I guess when I was reading through some of the research, I was like, it's not well understood. They have a pretty good grasp on what they believe is happening, but it has been cleared by the FDA. There's different companies. There's one that has, I think, like 12 different clearances. So it's really safe. It's been shown to, they use it for a variety of things, even like, sculpting, body sculpting. They can use it for.
Yeah, I've seen that. I've seen that. Heard of that. Yeah, I don't I don't know enough about that. I think the interesting concept that the only way it could really produce hair, back to that, or, a lot of clinics, natural clinics. And you even were mentioned that maybe, maybe in the future that you would even have a system in the office. But for stimulation and production of regeneration of tissues, trying to do that, right? And the major concept is, as you said here in the notes, is increasing ATP production. Right?
Yeah.
If you can increase ATP, well, that's the energy producing, on a cellular level. So then everything else changes.
Yeah.
And it's localized too, which is interesting.
Yeah. The area that's treated, right? The area under the treatment is where they find the increased, density of ATP. They've also found that it eliminates or helps to modulate things like reactive oxygen species. For the layman, that means basically when you see those fancy commercials, it's like drink pomegranate juice because it helps. It's an antioxidant. Well, a reactive oxygen species is an oxidant, right? And it bounces around and it steals things from other cells so that it becomes neutral. And it actually damages things like your mitochondria, your DNA, your cell walls, all that kind of stuff. So it actually helps to modulate the production of reactive oxygen species. And then it actually downregulates the production of pro-inflammatory mediators. So that'd be like, pro-inflammatory cytokines like interleukin-6 and that kind of stuff.
Yeah.
So it actually drives that down. So you're less inflamed, you have more energy, and there's less things bouncing around in there that's causing damage.
So it's kind of like applying a localized antioxidant that's not a topical, but really, promoting antioxidant species in the localized area.
Yeah.
So whether that's musculoskeletal injury, or I could imagine even with, I don't know. I think are they using in the Medi Spa cosmetic world? Are they using laser therapy like this? I don't know.
I have no idea. I know they use it for like skin tightening. Yeah. So they can use it for like skin tightening and stuff like that as well. Yeah. I mean, it's got a bunch of applications. This is just stuff that I found interesting. This is not by any means a super comprehensive list, right? Because I just talked about, they can use it for sculpting, like body sculpting. They can use it for like treatment of burns. They can use it for hair regeneration. They can use it for, localized inflammation, whether that's like a sprained ankle or something like that. I know that they can use it for like ligament regeneration in some cases.
I've even read in the past that people were seeing changes in actually weight, body composition. So it's like the sculpting where there's all sorts of different sculpting, but pre and post and weight loss was kind of crazy. I don't even know how it works, or, I don't know enough about that, but there's some interesting applications. I think, and it's been around long enough. It's not like something that just rolled in and some kind of, fad. It's been around a long, long time. So, I think if someone is dealing with, at least in our world, a musculoskeletal issue or maybe scar tissue or something like that, it's non-invasive. It could be something,
or even if you're trying to push, a specific system, you're trying to push the kidneys, maybe you apply some light therapy to the kidneys, and you get that appropriate light and that frequency and wavelength, and you can, achieve some results there. I mean, the applications, I thought it was really interesting. And actually what kind of piqued our interest was, we'd had one in our office as like the guy was trying to get us to buy his unit, and we tried it. I had a patient that had chronic low back pain, right? I'd tried everything. I'd tried vestibular rehab. We had tried, traditional like manipulative therapy. I'd sent her to PT. I'd sent her everywhere. And excuse me, it'd get better. It wouldn't stay better. I used a laser on her for 2 rounds of 3 minutes on both sides of her spine, on her quadratus lumborums. And she came in next time and she goes, "What did you do different last time?" I was like, "Well, I applied that laser." She goes, "That is the best my back has ever felt in 20 years. And it lasted longer than anything else I've ever had." And I was like, okay, like I need to look into this, because the only thing I did differently, because at that point I was a Band-Aid, it was just that degenerated that you're never going to completely fix it, but you can at least help them maintain their lifestyle. Yeah. And if you can help someone maintain their lifestyle for
longer,
then, and it's not invasive, right? And there's no injections.
And how long was this individual on the
6 minutes?
one time, 6 minutes. That's where I was like, okay, I need to investigate this.
Now you need to go buy 3 of them.
Yeah, right. And the only problem is you got to keep them busy, right?
Yeah, exactly. Can't collect dust in the office.
So that's pretty much, if you guys have any questions on laser, this is the superficial, the superficial facts, because if we start going down the rabbit hole, you can talk about wavelength, you can talk about, polarity, you can talk about frequency, you can talk about all that stuff. And it gets pretty complex pretty quickly. So if you have specific questions you want to know, please reach out to us. You can get a hold of us at info@brainstormingwiththedocs. If this is something that you think that you might want to use, it's worth looking into, because it's really fast. Like, you don't have to be on it for a super long time. It's non-invasive because you can apply it to, you just apply it to the parts of the body. It's not like they are sticking it inside you or anything like that. They do it across the skin.
That's right.
Really safe, been cleared by the FDA, has numerous applications depending on the wavelength and the frequency. And I mean, as far as that goes, those are 3 really awesome things that can really help make a difference in your life, whether that's a sprained ankle or chronic low back pain or neck pain or whatever. So
right. Yeah.
So definitely look into it as a treatment option.
That's right. Non-invasive and safe, and has been around for a while. So run with it.
If you're missing your hair, I mean, maybe I have certain people that I know that I think could use this. I won't mention any names, but they'll know who I'm talking about. So obviously, if you guys like this one was pretty short. If you guys have questions, please reach out to us. It's info@brainstormingwiththedocs.com. You can always get a hold of us on our websites. Mine is northlakescheropractic.com. Dr. Glenn's is drgharrison.com. Or stay tuned, drop a comment in the notes below, and we'll get back to that when we can. And stay tuned, because we're going to continue to roll out new content like this each and every week. So hopefully we find something that's good for you.
All right. That sounds good, Dr. Kolby. I look forward to the next one.
All right, buddy. Later.